So, hello and namaste to all of you. This is Name-Shalu Singh from Department of Physiotherapy and Diagnostics from Jayoti Vidyapeeth Women's University. So, I'll be talking about factors that affect clinical diagnosis. So, when we perform a particular test, so there is a possibility or there is a room for mistakes. So there has to be various parameters or various para, there is parameters that has to be kept in mind while performing a particular test. So certain parameters may affect a certain test in a different way. So for today's session, we'll be talking about those different parameters or those different factors which may affect your one of your particular tests. So first and foremost, let's talk about biological changes. So there are certain changes in lab test that will result which we can expect because of non-modifiable factors, and those factors are the biological rhythms, age, physiological changes, like in case of your pregnancy. And one can control these factors, that is by choosing the right time of the day or a month of the year. So you may consider the interpretation of test results, such as variation of reference ranges or thresholds for clinical changes according to age, gender, or your prenatal stage. So different biological changes can be. First and foremost biological change that we talk about is your aging, your age, right? So aging process, it is increasing polypharmacy, so and comorbidity. So the aging process, it is widely the responsible for change in your test results. So older people, they are more likely to have test results that have normal reference range, and lab, it can offer reference ranges according to age. So a certain parameter can be different for a certain group of people and different for other group of people. So it has to be, while performing a test and looking for while assessing your test result, you have to keep in mind what are the normal ranges for a particular age group of people. So lab, they should offer the range according to the age, but in case of other laboratory tests, the result out of range in an older patient, it should be interpreted with overall clinical image in mind. So what is the clinical condition of a person, that can also affect your test results. So assessing the magnitude and rate of change over time, it provides more detail in several cases than interpreting the value of the result. So the population range of test, it can show many more changes than that of a patient, such as liver enzyme or serum creatinine. Now, the previous results of the patient are always helpful. Secondly, while interpreting laboratory test results, when interpreting these laboratory test results, a common sign of the effect of sex age is observed. So, also other variables are like ALP or serum alkaline phosphate, which is asking for liver function. So, the upper limit of reference, it can increase reported during the puberty, and it is the time of maximum, because it is the time of a maximum remodeling of your brains. So ALP, these values may change during your puberty times, right? So even if the value is high, you won't say it is abnormal. It will lie in your normal range, because it will be different for a person hitting the puberty. So ALP levels will further fall to another upper limit after this period through younger life, and it then rises again especially in case of your females, like a premenopause. So, which reflects high rise in your bone turnover, and in case of serum ALP, the rise may place in women in later stages of pregnancy because placenta it produces ALP, and other times like in weeks after healing the fracture. So another common example that I can talk about is values of your lipid profile. So in a lipid profile, it changes with age. So total triglyceride levels in lipid profile, what we measure is your TG levels, TC levels, LDL, and your HDL and chylomicrons. So total triglyceride levels and LDL cholesterol levels, they increase with age, and until around 50 to 60 years of age in males and 60 to 70 years in your females, and when they start to decline, it is most numbers of adults. So TG levels, they may keep on rising in other females, and most labs, they don't report changes for lipid levels, and as it is known, they known to be less clinically important than targets on major cause of increased levels and risk of heart disease. So when we discuss interpreting lab results actually in an older patient, we make sure that age appropriate range is used when available. Normal changes that are relevant to age, that is example poor renal function, they may help determine result out of your reference range in older patients. However, it is only the age that is responsible for your abnormal result. Now, what could be your biological parameters? So, certain lab parameters, they vary according to time of a day, month, or week, or year when sampling them. So, that can be mostly these factors can be affected during your hormone production. So, hormones like testosterone and cortisol, your body temperature, they vary throughout the year. Your cardiac function, they may vary according to the daytime. They can be varying throughout your day. Your platelet function, your cognitive function, they all follow a circadian rhythm. Okay, so they follow the natural biological clock. So they may vary within according to the time of your day, month, or week. So to work for this effect, there are some laboratory test recommendations and at a specific period of the day. So let us, for example, say the sampling of testosterone, it must be done from 7 a.m. to 10 a.m. So this is because it usually occurs because very high testosterone levels, they take place in early morning time. So and they are significantly lower, like around they get lower to around 50% in during evening, especially in males at a young age. So serum cortisol, it should be sampled for most purposes in early morning as during diurnal variations, and is marked with the levels of least 50% to 100% higher in the early morning than that in your late afternoon. Now, vitamin D testing, it can be affected depending on the time of the year. So the most obvious example is being winter, where will be your lowest, because in winter there is less of sun. So less of sun, less of vitamin D. So during winters, the vitamin D level is lower. So other factor that affects your test result is your menstrual cycle. So in females, in their menstrual cycle, they have expected rhythms of LH and your FSH and your progesterone and estrogen every month. So in a general setting, such kinds of hormones, these levels, they may require to investigate the conditions like amenorrhea, uh, or oligoria. So meaningfulness and interpretation of these results, they depend on not on just the value, but also on the stage in a cycle and when the hormone was taken. So LH levels in a menstrual cycle, uh, it reaches peak mid-cycle to deal with ovulation. Now, FSH are also responsible for peak mid-cycle. The predominant estrogen in ovulating women, estradiol, is highest before ovulation, and it then reduces if fertilization doesn't take place. So, investigation of estradiol levels, it is not important in women who are going to take estrogen-based oral contraceptives because it suppresses the ovarian axis. Now, FSH and LH, they are suppressed in women who are going to take depot post progesterone. So we all know that progesterone levels, they are peak in the next menstrual phase after ovulation to prepare for endometrium. So it is often important to measure progesterone levels to establish if ovulation takes place. That is usually 7 days before your period of menstruation. That is around 20 days of the 21 day of the month. If the woman has if a woman has 28 day cycle, then on the 21st day of the month. So during menopause, FSH levels, they tend to rise, and estradiol levels, they reduce. So it is not always reliable to monitor hormone levels when it comes to predicting the day of menopause, and it as it changes occur as per the ovarian activity. Now, pregnancy, during pregnancy, psychological changes result and in variations in several lab parameters, including renal and your liver function. So, blood volume and hormone levels. So, for different stages of pregnancy, reference ranges come, and for some medical laboratory tests. So, however, those ranges are sometimes not as well defined as your general range. So, along with that, pregnancy based changes like changes in your protein binding, they can affect the assays differently. So, for example, free hormone levels, they can depend on the assay. So, has to be taken in while interpreting the laboratory test results. Also, based on the reference range, patient should contact the lab and in case of any doubt. So when performing lab investigation in a pregnant woman, so the week you have to note down the week of gestation, and there are some common example of lab values which change during pregnancy. Your first one will be your reference range. So the reference test, it is a numerical range of result which is derived strategically by testing healthy people. And however, healthy is not simple. It relies on a different assumptions. So some factors to define a range simply with perfectly healthy in many cases to make it unstable and unrealistic. Now the range is also referring widely to Gaussian distribution, and hence 68% of values are based on your standard deviation of your mean value. So 99.7% of values of 3 SDs and 95% in your 2 SDs. So however, a lot of ranges lack in your Gaussian distribution, but the upper end is skewed in upper end, and the range can derive by turning the log of data and just by considering 2.5th or 97.5th percentile in a population that is being studied. Now, the variation of laboratory test ranges. For a laboratory test, reference range, it usually covers 2 SDs from the mean value. It means that 1 in 20 healthy people will have a test result of reference range. Now, these ranges vary from labs to labs, and they can change if new evidence is available, and the lower and upper limits are not absolute in the range, and they can't define any abnormal or normal results. But there are certain points which is the possibility of certain situations may rise. So some of the reference ranges depend on the changes from international bodies to optimize the outcome of patients instead of statistical distribution of the population. For instance, the upper reference range is based on guidance in TSH of early pregnancy stage for serum uric acid in patients having treated to lower uric acid. So the limit depends on the guidelines of the European European League Against Rheumatism. Now, the interpretation of results out of given range depends widely on your clinical background of patient and clinical questions and pattern of your other abnormal ranges. Now, now next is your individual changes. So health status, diet, your lifestyle factors of patient, they can have pre-analytical influence of lab changes. So nutrition and diet, like first factor, the calorie restriction, fasting, your malnutrition, food exclusion diet, and dehydration, they are responsible to affect lab results. And in some laboratory tests, their significance may depend on certain dietary factors. So it is vital to ensuring the sample gluten in the diet for several weeks before your serology test for celiac disease patients, or fasting before checking effect of an investigation in a patient with high triglyceride levels. So assessing diet factors in some cases can help interpret unexpected results, that is a vegan or vegetarian diet, which may reduce vitamin B12 levels and increasing ketone levels, and a high protein diet and can increase uric acid levels due to low carb diet. So let us suppose the fasting condition. So up to 12 hours of fasting before laboratory test may help to get most accurate result in these laboratory tests, and according to clinical scenario, which may affect by taking certain foods like uric acid. They usually there is no need for fasting for accurate results, but a recent diet intake may help determine unexpected outcomes. In glucose, only when indicated. So these days, HbA1c for most patients is recommended as a first choice of test in monitoring and diagnosis of type 2 diabetes. So they do not need fasting. While in case of TG, fasting is not necessary for most patients in lipid testing, and it may recommend monitoring high triglyceride levels in individuals. So in creatinine level, for measuring creatinine levels, high amount of meat in a recent meal, it can affect serum creatinine and test significantly. And it must in mind when testing for monitoring EGFR levels. So starvation and low caloric intakes, it results in some changes to parameters like thyroid, your glucose, your renal function, liver functions, and lipids. So the levels of uric acid may increase due to ketonemia, which is the cause of lower clearance. Now, dehydration, it can be the cause of potassium and sodium imbalances. It can also affect several other indicators like urea and creatinine, hematology, lipids, etc. Now, malnutrition, it is having different effects on lab results, and according to the nature of nutrition status of a patient, malnutrition is considered as a lack of energy and protein and without deficiency of your micronutrients. So, however, the malnutrition is defined as overnutrition and undernutrition or deficiency of nutrients. So, malnutrition is known to be the cause of results like reduced ferret and folate, as well as in levels of your vitamin B12. Now, alcohol on laboratory tests, the effect of alcohol may vary on extent and duration of use. So, if there is transient or acute effect of consumption of alcohol, that is within 2 to 4 hours, and include increased plasma lactate and serum glucose with lower excretion of uric acid, because taking hepatic gluconeogenesis, here are the chronic effects of consuming alcohol on laboratory tests. So these are the levels of GGT, that is your gamma glutamyl transferase, as well as mean cell volume, that is MCV, which are widely using test for high alcohol consumption. Your ALT, that is alanine aminotransferase, or AST, aspartate aminotransferase, or ALT AST ratio. And ferritin and uric acid, because of alcoholic hepatitis and fatty liver, creatinine kinase because of alcoholic myopathy, and other abnormalities like thrombocytopenia and anemia. So consumption of alcohol, it can also have a vital role in deficiency of minerals and vitamins, and the effect may occur due to replacement of food consuming with alcohols and vitamins, like lower levels of your vitamin A, folate, vitamin B, and your calcium. Now, caffeine, when we discuss lab parameters, there is no complete study on the effect of caffeine. So, it is having a short lifespan of 3 to 7 hours, but it varies among people. So, consumption of caffeine can cause elevated levels of blood glucose level. It can also affect investigations like metanephrine's interpretations, and when it comes to investigating your hypertension. So the timings of investigation in case of illness, the significance of investigation, it relies on the time of the sample taking to the stage of disease. Now the selection of right investigation, it can also influence the stage of illness. For instance, serology test, it may be negative for syphilis, and in case of sample is taken for exposure too early. So people are different types of there are different types of serology tests which provide details regarding past or active infection. So acute illness may also affect the results of your investigation. For example, if there is a case of acute protein phase levels, it can increase by infection and inflammation, and along with malignancy and chronic disease. So, in case of smoking, exposure to nicotine and smoking can have both chronic and acute effects on investigations. So, within 1 hour after smoking, up to 5 cigarettes, serum or plasma concentrations in fatty acids, glycerols, adrenaline, cortisol, and aldosterons may rise. So, chronic smokers may have significant rise in your leukocyte lipoproteins. So, heavy metals, hematocrits, your tumor markers, and your reduce in activities of enzymes. So, next will be your exercise. On laboratory parameters, the effect of exercise depends on your health status of the patient, intake of water and food, or during or after or during exercise. So vigorous or extreme exercise in a person who is not familiar with this activity level may cause changes in some lab parameters, and it may cause changes in some of your lab parameters, and in these patients, for instance, most common cause of increase in creatinine kinase level is exercise. So creatinine kinase levels, it can elevate due to intense exercise for several days to weeks. So thyroid function is also supposed to change among people who are going through the high intensity workout. So for instance, FT4 and TSH levels can increase in anaerobic exercises but reduces FT3. So AST and ALT levels, they can also rise after a workout. So after a workout, hematuria and transient proteinuria, they are also common, but they resolve after a couple of days. So there are some other analytes that can be raised by exercise, and those are as follows, like urea, creatinine, prothrombin time, lactate dehydrogenase, D-dimer levels. So the activated partial thromboplastin time, that is your APTT, and fibrinogen, they can reduce. So most of those effects may be transitory, but it depends on your individual health factors. Analytical changes, if I say, so these variations take place due to error in your test methods. as in your equipment. So it may cause a slight difference in analyte value and at every time of your measurement. So lab equipment and modern test methods mean more accuracy in lab test results. So usually variations in measurement should less than half the biological variation of the patient. So after collection of a sample at the practice, it is vital to know about the type of container as well as the medium of the sample for the specific test, and it can also affect the lab results. So for instance, a PCR testing swab, it should move in a dry tube with your viral transport medium. So, blood testing is one of the least transparent and most misunderstood parts of your medical science. So, we simply simplify that with easy to understand results and affordable testing you can do at home. So, this was all for the factors affecting your clinical diagnosis. So rest, we'll try to. This is it for your topic, and rest we'll try to figure out in your next lectures. So that was all for today. So we'll meet in next class. Until then, if you have any doubts or any confusions, you can ask me. And take care and